I had heard about 3D mammograms a few years ago when they first came out, and so I asked the doctor, and she said, "Oh, this year, we're able to get you the 3D." And I was pleased because I knew it was a more in-depth exam. The 3D mammogram was actually more comfortable than the previous procedures that they had used. About 2 weeks later, I had a call from radiology that they thought I needed an ultrasound. They saw something, they weren't sure what it was. So I went in and had the ultrasound done, and then they told me that they wanted me to do a biopsy. So they did the mammogram biopsy, and I would say the very next day, I had a call from the nurse navigator to set up an appointment with her and to pick a team that because we were going to have surgery. This was all new to me. I did not have any family history of breast cancer. My first appointment with Dr. Paxamatis, he suggested I would be a good candidate for the intraoperative radiation treatment that was offered to low-risk patients and hopefully avoid any post-surgery treatment. The recovery was amazing. I did not have any post-operative pain. Oh, and I was driving after 5 days. I would highly recommend that people use the Lakeland system. Their communications with their patients is wonderful. We have the My Chart that I refer to regularly, and I can communicate with all of my doctors. And then you feel comfortable to even call the doctor's offices, and they will talk to you. Everybody was just very helpful in all respects. I just want to make sure that people realize they should continue to do their wellness checks and to do these screenings for mammograms and other screenings as they're recommended, and to do breast self-exams at home also. I just feel it's important